We're back with Sussie the dog. She's been on Pyrantel for Parasites for the last 3 or 4 days, I guess. And she has put out some worms in her poop, some dead worms, so that's good. We're getting some out. But it's been 4 days, and I just want to test again and see if her body can maybe handle a different parasite medication or one in addition. Again, I like to hit hard on the parasites because they are difficult to kill. They can become resistant to medication, so I generally go by Dr. Simon Yu's rule of thumb, which is hit long and hit hard. So that's what we're going to look at today. We're going to retest her and just see if we can hit harder or hit longer on her. I did get stung by a bee yesterday, which is why my face is all swollen. We call this Franken Face in my house. But I feel pretty good. I just have a really swollen face, so that's that. We're going to get started with Miss Sussie, so we're going to test her baseline here. One more time. Okay. And I'm just going to kind of just start going through. We've got amoxicillin, an antibiotic.
No.
No. We've got Tinda from a pharmacy, a local pharmacy. No. Levamisole for worms.
Maybe a little bit.
Maybe a little bit. Okay. Mebendazole. No. Diethyl for worms. No. We've got ivermectin for protozoans. Tinda, a different format of Tinda from India. No, not testing well on the Tinda anymore. Very interesting, because she was testing well on that last time. Alinea. No. Albenda. No. Triclab for flukes. Praziquantel for flukes. I've got Pyrantel. Hold on. Let me get her. Okay.
Yes.
Okay, so she's still testing really strong on the Pyrantel. Stronger than baseline, right? So if she were still testing at baseline, this is the one that she's already been taking for the last 4 days. She's been taking a 1/4 teaspoon twice a day. Is that right?
Yes.
1/4 teaspoon twice a day. That's what we dosed her on last time. She's on this. If she were still testing the same as baseline, I would actually keep her on it as long as possible until she was testing weak on it. That's again this philosophy of hit long and hit hard. So I would hit her for as long as I could on this until she was testing weak on it. Since she's still testing strong on it, I'm suspicious that maybe we can increase her dose. So we're going to look at that in a minute. Retest that in a minute and look at that in a minute. I brought some wormwood, which I had forgotten last time we tested her, so I just want to see if that will help. No, not really. Okay, and then I'm going to go through her, she's got some detox. She's got DE, diatomaceous earth here, that she's currently taking.
Yeah, a little stronger than baseline.
A little stronger than baseline, so we'll probably keep her on that. And then I've got some drainage. She's got some drainage. We've got Coracaina and gallbladder ND. Those are the 2 that she's on already. She's getting antsy. I'm going to give her a treat. Here's a treat. Here's a treat. So I'm going to test her on the Coracaina and the gallbladder. Those are the 2 she's on. And then I've got 3 others that she had tested well on in the past, and I just want to go through those and check.
Yep.
Strong on the gallbladder. No, done with the Coracaina. It's not unusual to be done with a drainage remedy in 4 days. That's actually not unusual. Immune. No. Skin. No. Renalex, which is let me take this out, which is a kidney support, drainage support, kidney bladder. No. Okay, so let's retest the gallbladder.
A little stronger, but not a whole lot.
Not a whole lot, okay. Let's go back to the DE.
A little stronger, but not a whole lot.
Okay, so these two are two things she's already on, so I would tend to just keep her on it because she is testing a little bit still stronger on those. Let's try the pyrantel again.
Yep.
Okay, she's testing pretty strong on the pyrantel. So like I said, I'm suspicious that maybe we can increase her dose. So I'm going to go with half a teaspoon per day. That's what she's taking now. So let's start there.
That's weaker.
Weaker. Okay. Try it one more time because it's hard to take stuff out. Okay. Let's add a quarter. Let's go up by quarters until we see when she's strong.
Stronger.
Stronger. Okay, let's go up by another quarter. So that's 3/4 right now. This will make it 1 teaspoon per day.
That's weaker.
That's weaker. Okay, I do have a second, Missy. I do have a second bowl here, so let's take a quarter out. I like to verify, I like to go back and just make sure we're seeing what we're seeing.
Yep.
Okay. Okay, so this is 3/4 of a teaspoon per day. So I guess that's a little more than half a teaspoon. Or sorry, a little more than 1/4 of a teaspoon twice a day. So 3/4 of a teaspoon per day. So just a little bit more is what she's telling us. She's not actually telling us anymore that she wants the mebendazole and the Tinda. Last time she was testing well also on the mebendazole and on the Tinda. And this one, but not all together. So we had chosen just to put her on the pyrantel because it's a sweet liquid. It's easy to get her to eat it. So apparently she's going strong on the pyrantel, just a little bit more of it. And the plan for Susie probably now is to check in and probably another 4 days, probably 6 days. That will bring her to 10 days. I will probably check in again at 10 days on her. I would like to see her do this for at least 10-day rounds. So I'd probably check in another 10 days, another 6 days now on her.